Thanks very much for signing up to this session and for coming along. This is an event as part of the DigiFest series, an annual digital health and care knowledge exchange event. And I'm Roger Halliday. I'm the Chief Executive of Research Data Scotland. And I'll sort of just take you through in a second what we're going to cover. Hopefully you're here because you're curious about how data is used well and how that can save time, money, and lives. And I'd hope that what we'll be able to do this morning is give a bit of inspiration about what's actually possible in that space, and or what will be possible on future, and kind of the progress that we've got on that. So I'll be doing a bit of that by talking about Research Data Scotland and about our new service, the Researcher Access Service. So that's that RAS overview that is on the agenda. Then my colleague Layla will be talking about what we're doing to develop best practice standards across Scotland. And then we'll finish up with a conversation about public engagement and how we make sure that everything that we do in using data has got the support of the public. So yeah, clearly not everything that you could do with data you should do. So thanks for joining us this morning. Hopefully that's the kind of thing that you're hoping to hear about. And to say that, I've started and I've had a career in government, often in analytics and statistics. So data has been at the heart of a lot of my career and helping me as an advisor to ministers to know what to put forward, to know what might need to change policy-wise. And so having a kind of strategy for health and social care data is a really important guide for us working in that government space and working in the public sector, and to kind of think about how we do that and how we make the most of data. And it really it has got these three important themes that build up towards the overall vision, which is to improve care and well-being of people in Scotland by making the best use of data in the design and delivery of services. And the three themes here, I think, are vital. So I've definitely seen people using data. I use it myself to manage my own health. So actually making sure that people have the understanding of the things that can both make better choices within the context of health and social care services, but also for improved self-care and healthy choices. So yeah, the second thing is we've got fantastic data here in Scotland, but that needs to be in the possession of people that can use it to make decisions that improve people's health, and make sure that there's the data, the services are being provided safely and in ways that actually improve outcomes. So empowering those that deliver health and care services, the second important part of this. And then the third one, to making sure that the data is actually there's an ecosystem for sharing data for research and innovation, because clearly that's going to be vital to making and continuing to make health services and care services sustainable as we move forward as a nation. So that's the overview of the strategy, and it really comes under eight themes. And today we wanted to focus on that research and innovation part of this, but clearly a number of the other themes around ethical approaches, around data access and data protection, they're all important building blocks on which some of the other priority action areas, including research and innovation, are based. So yeah, but like I say, research and innovation is key if we want to make some real change to the services that exist for people across the country. So, what am I talking about? I just want to, when I say about research and innovation and using data in that space, well, I just wanted to give a couple of examples of that. So, this is the first one. So, we're talking about how do we reuse the data that's already gathered as part of the services that people receive across the public sector and potentially wider, but let's stick to the public sector for this. That fewer, and this is a particular example around children. So as you grow up and as you the children across Scotland come into contact and receive a whole range of different services, whether that's around maternity, whether that's around schools, childcare, and for some children, children's social work, for some children, links to the police and justice services. And lots of organizations are gathering this data, but they're doing so independently. And so, if you're wanting to develop services that are going to improve children and families' lives as a whole, then actually being able to piece this together, so to get a picture of what's going on for a child, a family, is really important. The difficulty being, though, that some of the data is collected in the health system, some of it's gathered in local government, some of it's gathered like the births and deaths records are the national records, and some of it's gathered by other public bodies like Police Scotland. And over time, it's been really difficult to start piecing this together and accessing it and using it for research that's in the public good. And when you do that, we can really understand what are the things that are protective factors that will improve things progressing to negative outcomes for children. What are the things that the services that actually make a real difference on their own or in combination, and what makes a difference for particular groups of people? Well, all of this is actually possible if we start bringing and connecting this data around a person, place, business, or family. And this is another example here that we know actually prostate cancer is one of the biggest killers of people from cancer in the UK, 12,000 people. And we also know that the treatment for prostate cancer is really variable in terms of its success, in terms of the radiotherapy people receive. But we don't really know why. And so a study here led by the University of Edinburgh, Proseca, is looking at trying to solve this and trying to improve potential treatment and personalized treatment for people that have got prostate cancer. And they're doing this by bringing data together from imaging data that they've got of people that have got prostate cancer, of bringing together data on other health interactions with the health service, including some detailed notes that are available for people. And it's that sensitive data and the ability to bring data together from different places that's helping them to understand what treatment works for who, and to develop that optimum treatment pathway for individuals. The difficulty being that to actually assemble all that data that I was describing has taken quite a long time. It's taken 18 months. And clearly, if 12,000 people are dying from prostate cancer in the UK every year, cycles of innovation that take 18 months to actually get the data in the first place are just too slow. And this is one of the reasons that we set up the organisation Research Data Scotland. I say we, that it was really government coming together with Public Health Scotland and some leading universities around Scotland, Edinburgh, Aberdeen, Dundee, and Glasgow, to say, actually, we've got some fantastic data in Scotland. We've got lots of expertise in curation of that data and using of that data. And we've got the ability to bring together teams of people that can translate having that data into fantastic research and the change that it needs, whether that's in government, in the public sector, or in industry, to really make the change using that data to improve the lives of people. So that's our mission really here, is learning from kind of that example that I gave about prostate cancer. Our real focus is how do we make it faster and simpler to access public sector data for research. And we're, because as I mentioned, the data is locked away in different systems, whether that's in the NHS or local government or other parts of the public sector. It's tucked away, and when you come to a new research study, that process of, where is that data? I'm not quite sure exactly what data we've got. Then once you work out what data you've got, actually getting it out of the places, it just takes, that's what takes the time, and that's what creates the inefficiencies in the system. So our model's to move from that to a more proactive model of talking to the owners of data and getting them to contribute the data for use in research. So we've got two aims as Research Data Scotland. One is to transform that process that I've just described there of making data access available. And the second one is actually going and providing a service to researchers to make that data available for their use. And we're building upon some fantastic expertise that exists in Scotland. So we've got some partnerships that exist between parts of our NHS and the universities of Glasgow, Edinburgh, Aberdeen, and Dundee. And we've got expertise within Public Health Scotland and the University of Edinburgh in secure computing and providing services to researchers based around particularly on healthcare services. What our role, and then also on the right-hand side here, we've got lots of data that exists about Scottish people, places, and businesses. So, for example, the top box here is the Integrated Data Service, which is something that's run by the Office for National Statistics. Well, they hold data about welfare from Department for Work and Pensions and from HMRC on tax, and from business surveys and business data that ONS hold. So our job here has been to connect all of these different parts of the system into an integrated system that makes it easier for researchers to discover and use the fantastic data that we have about people in Scotland. And the good news is that actually we've got some good sort of support and systems to do this, because generally, as Katie will say later, public engagement's key in all of this. And the public generally says that as long as, whatever we do with data that's in the public good, that it avoids re-identification of individuals, and that it's really clear who's using what data for what purpose. If those conditions are met, then actually the vast majority of the public are saying, absolutely, I expect you to be using data to improve the services that I'm receiving, which is an important rock on which we're building. And another part of this then is that middle sort of condition about avoiding re-identification of people. Actually, we're using here to keep that data really secure and well used, an international best practice framework that says the only uses of data for research are for accredited researchers, so trusted researchers, that their projects that have to demonstrate that they're in the public good, that they are in really secure computing settings that we've got here in Scotland, that data is de-identified so that we don't know people's name, address, and so on, and that any outputs that come from the researcher then are translated out of that really secure computing setting are tested to make sure that they won't re-identify anybody. And what we're able to do then is to build a service on top of that. So this is what we've done, a researcher access service, and this will be something that, you know, if you're a researcher, you want access, you want to use this data, this is the way that you'll do it. And you know, our aim here is to, as our mission, to make that service something that is a lot simpler, and by simpler it'll mean that service is faster. And you know, what we're going to be doing is making sure that service will work. You know, the simplification will only come from making it work both for researchers and for the people actually using the system. Sorry, actually providing the service. Sorry. And the reason that we've kind of brought this in, because there are a range of services out there already, is to provide a sort of to have a way of sort of consolidating and helping researchers know over time, this will be available, to know the route in that they can take to access data from all those different places that I mentioned earlier on. So that in itself can lead to sort of difficulties, delays to access to data. And this is broadly the different stages in it. So if you want to do a bit of research, the first thing is you've got to kind of work out, well, what is there some data here that can really help me out, and how do I then get hold of that? Where do I get it? Who do I ask for that data? So there's a sort of discovery phase, and you know, the idea then is that we have a data catalog that you'll be able to go in, and in fact you won't be able to, you can go in right now and see what data is available and find out, yeah, what do I actually do? How do I have to make the public benefit case? Who do I make it to? And how long is that going to take? So there's a discovery phase. Then you actually go through, you put an inquiry in, you apply, you get some advice back about the quality of the data, what data is most relevant for you, and what you actually need to do in putting that public benefit case together. That case goes forwards. There's a decision on whether that public benefit test is met. Then you end up in the sort of access space and you get that data served up in that really secure environment. And currently we're working at the national level, and that data's in this thing called a national safe haven, which is that super secure computing environment that's run by Public Health Scotland and the Edinburgh Parallel Computing Centre. And then finally, you'll get you'll have online access to that service, and then finally you'll get the data being able to be taken out of that service. So and this is and just about there that we launched the first version of the Researcher Access Service in April, and that's that digital end-to-end service, a significantly faster service than we've seen before. And we've done that on 9 data sets initially, just so that we can check out whether that's working working well and working quickly. And these are the 9 data sets shown in yellow on the left-hand side here. But would say that while we've got this fast track process in place, there are a whole range of other data sets that are also available for research that have national coverage across Scotland, and they're in the left-hand column here. And that then we're looking to scale up. That's the next phase, right? So looking to move from 9 to a much wider range of data sets using the ones that are in the National Safe Haven, and looking to do that over the coming year. And then at the same time, we're going out and speaking to other data owners, and particularly know that researchers are looking for data from GP practices. And so working with Scottish Government and National Services Scotland on that. But then also you can see that there's a range of other data sets beyond health that we're looking at, which is clearly important for understanding some of the underlying causes of poor health and health inequalities. And then on the right-hand side, some of the plans that we're starting conversations, particularly around social care, genomics, NHS laboratories data, that will over time become available. So that's the sort of data set journey. And the final thing that I'll say is that we're looking to launch the next version of the Researcher Access Service in spring next year. And that will do these things here. In particular, move the data onto a new data governance basis that should make access to data a lot clearer and therefore even quicker than we've got it so far. So that's the broad journey that we're on. At a national level. And then I think my colleague Layla will take up the story of what we're doing to make that available at a local level by developing standards and approaches. So I'll look at the questions in the Q&A. I'll start answering some of those, and then we're going to have a Q&A session at the end here, but I'll hand over to Layla just now.
Thanks, Roger. Good morning, everyone. I'm just going to open my slides. So what I'm going to be talking about is particularly around the Scottish Safe Haven Network and the work that we've been doing as Research Data Scotland with them. And also to give you a bit of background around the network, but particularly in the context of a refresh of the Scottish Safe Haven Charter. So I'm hoping that everybody can now see my slides. It makes it difficult for me to see everyone else, but that's fine. So the background is, I think the key thing is as part of what our Research Data Scotland was set up to do, and also as a key part of the research and innovation chapter of the health and care data strategy, we're working with the national and 4 regional safe havens to work ever closely together and bring together the existing system, and to build on the great work, kind of experience and expertise that existed. And one of the key things that we've been doing the last year is there was an existing Scottish a charter for safe havens in Scotland that was published in November 2015. And obviously quite a lot has changed in the last 9 years, whether that's in terms of technology, the external world, within the safe havens themselves. There's been quite a lot of investment in secure data environments in England, which are almost like the equivalents to the safe havens. And it was a good time to look at the charter and update it. So we were commissioned by Scottish Government to undertake that, and worked with colleagues within the network to undertake the review. And a key part of that is to provide additional reassurance that hopefully wasn't really needed, but just to really inform information governance leads and Caldecott guardians, and to update it, basically. The objectives were, we considered whether it was a small or kind of more comprehensive review, and agreed to revise the existing charter with the work and the content. So it ended up being quite a comprehensive review, addressing limitations, because the joys of it being 9 years old, some of it was limited, but also fair play to the people who wrote it the first time round, writing something from scratch. It was a really useful document, but there were some things where it was looking back, it was ambiguous even, could be interpreted in different ways. And also, one of the original purposes of the charter had been to bring in some form of accreditation. So that was also something that we looked at, and then also aligning it with the health and care data strategy more broadly, and other work that we and others are doing. So really briefly, and I think most people on here are probably aware, but just in case, the Scottish Safe Haven Network is the national safe haven, which kind of Roger mentioned in particular, which is held by Public Health Scotland. And then there are the 4 regional safe havens who hold health board data, and are based geographically in Aberdeen, Dundee, Edinburgh and Glasgow, and work very closely as part of the universities and NHS there. And then also RDS has a role in terms of coordinating the network, providing a front door, and also working with the different partners, particularly say in the Scottish Government. So Chief Scientist Office is on there, but also should be digital health and care, for example, within Scottish Government. And then kind of key updates to the charter were adapting to modern governance and technology. So it's aligning with contemporary governance standards and advances in data security, so making sure that, and also just highlighting that the Safe Haven Network is operating to the highest levels of integrity and protection, and outlining in how they're doing that, because there have been a number of forms of auditing that have been introduced in that time, and are undertaken, and just outlining. And what we did, which I have to put full credit to a colleague, is have a more principles-based approach. So there's a much greater focus on the 5 safes principles and aligning the charter to that. So in some ways it seems quite simple, but it was really clever in its simplicity. So aligning the charter to the 5 safes and the 5 safes framework, and I'll come on to how we've done that. But those 5 principles means that we've got a charter that's very accessible, that is readable and can hopefully last some time in terms of the next 5 years, but also we will have annexes that will also be put online over the coming months that can have much more detail, and we can change those annexes as other things evolve without having to update the whole charter. And then protecting privacy while advancing innovation. So it's balancing, ensuring that we've got the right safeguards in place, but it's proportionate to support the use of public sector data for research, and that the data is being used to benefit the public without compromising individual people's rights. So the first principle around secure access in a controlled environment, ensuring that data is strictly controlled, the use of data is ethical, individual privacy is protected, and the research data sets are held in a trusted research environment, and that robust safeguards are in place, along with independent audits and endorsement, and assurance that the safe havens operate under rigorously applied standards. The second principle, that ethical conduct and professional responsibility. Obviously, this is fundamental in terms of ethics, but also includes a commitment to maintain the highest standards of integrity, confidentiality, and respect for individual privacy rights. Principle 3, the collaborative governance and research to promote continual development of health and social research and innovation across the safe havens and with Research Data Scotland, and to share and implement across the network best practice. Hopefully I'm not going too quick, just conscious of time. Principle 4 on transparency and accountability. So promoting openness and public understanding, which again we'll come on to partly what Katie's going to be talking about, but that we make sure that everything is clearly documented and is accessible to relevant stakeholders. and that standards and compliance with established standards is published. And lastly, Principle 5 around assessment and endorsements to ensure consistency in the application of good practice standards and legal ethical operations. And the safe havens undergo regular assessments to ensure compliance with information governance and cybersecurity. And that as part of this, they're operating with the endorsement and regulatory support from Scottish Government, the host NHS boards and Scottish universities. So it's really cross-sectoral. It's really important, the kind of link between the NHS, Public Health Scotland, Scottish Government and the universities, really bringing different players together and balancing the different needs and responsibilities across them. So just the last few slides in terms of the conclusion, the Safe Haven Charter refresh just secured Scotland's commitment to ethical and innovative healthcare research. As I say, it was a key part of the research and innovation chapter of the data strategy. And we're going to continue to work with stakeholders and the public. There were a number of workshops that were held to feed into this with different stakeholders. And as part of putting it in place next year, we'll again just continue to work and communicate with people about the charter, so it's not just that it's agreed and it sits somewhere online. We want this to be something that we really speak to and continue to use to support research. So lastly, we presented the revised charter on Tuesday to the Scottish Government Health and Social Care Data Board, and they have endorsed it. There were some small comments on the charter that we're going to incorporate, just some small language. We'll then be rolling out kind of the publication and comms around it early next year. And then also promoting awareness of the updated charter, particularly with key stakeholders, mainly in Scotland, but we have also shared it with others in England and Wales, because we're really keen that this is part of a UK-wide approach. And a lot of this, the Scottish Safe Havens are really punching to their weight in terms of UK-wide projects and other things where they're looking at standards and developing approaches in this space. And then as part of the Scottish Safe Haven network, we're, as I say, going to publish a number of appendices, some of which are already drafted, and others we will develop over time to complement the charter on standard ways of working. And these will all be published with the charter on the Research Data Scotland website. And we'll also be reporting on an annual basis on activities and impact to Research Data Scotland. So this is going to be RDS's role, but on behalf of Scottish Government. So we'll work with the network to do that the first time next year. And then that will be an annual reporting mechanism. Because as I say, there's already auditing that takes place. There are discussions UK-wide about accreditation, but there's also fantastic research projects being taken place on individual safe havens and involving 1, 2, 3, 4 and all 5, and it's part of this wider work to work ever more closely together. And lastly, we've noted that we would do a review of the charter again in 2030, in effectively 5 years' time, unless it seems that something more sooner is needed. So that is my whistle stop. I will see if there's any questions and respond to those. Otherwise, just in terms of time, we'll pass to Katie for public engagement.
Good morning, everyone. Thank you very much for coming along. My name is Katie Oldfield. I'm the Public Engagement Manager at RDS. And as Roger summarised so nicely, I think my role is making sure that what we could do with data, we make sure that we should be doing with data by speaking with the public about what they want. So we are committed to embedding public engagement as a vital part of the research we enable. The data that we work about is about the people of Scotland. They are an important stakeholder in what happens to data for research. Everything that we do ties in with larger engagement pieces that are carried out across the UK. We're really interested in maintaining that social contract with people about what happens to data about them to improve the lives of people around Scotland. Our approach to public engagement involves a lot of different things. One of the ways that we do this is to directly involve members of the public in our work. One of the ways we do this is through a public panel that we co-run with SCADA, and we discuss lots of these progress points that Roger and Layla have been talking about, as well as have researchers come along to talk about the actual research that's done with data. We also have public members sit directly on project teams, working with us, in particular highlighting where we need to be explaining things, asking really good questions. Whenever we have public members on project teams, they always bring such a valuable perspective and change the way that we think about things. We also engage and communicate a bit more widely as well. So this brings in the work of our communications team. We have lots of good things on our website, sort of videos, wider communications about the work that we're doing, but also data more broadly, the 5 safes that Roger explained earlier about how the researcher access service works as well, to really make sure that we're being transparent about everything that we do. We're also doing more work to actively go to where people are, such as our public engagement fund, which I'll speak a bit later as well. By having these conversations more broadly and being really transparent, we really are trying to build trust in the whole system and the work that we're doing as well. We can't possibly do this alone. RDS is one small bit of a much wider industry. So we are involved with a lot of cross-sector networks, such as PEDRI, a 4 Nations PPIE group, Scott Penn, and the TRA community. I see from some of the names attending today, these will be familiar networks to some of you. So I mentioned about our Scotland Talks data panel. So this is a public panel which has been jointly hosted by SCADA and RDS since 2023. We recruited 20 people via post. We did this to try and get a representative sample of people across Scotland. And the panel discussed lots of different things. They discussed the whole data journey. So what data should be available for research, how it is accessed, the governance around that, and also what the researchers actually do with that data and how it's communicated more broadly. It means our panel have a really good idea of what happens from data start to finish and could give really valuable feedback to anyone who presents in that process. So we're about a year into our panel now, and we're doing some formal evaluation about it, but informally we've heard back that the panelists are really enjoying it. They're enjoying meeting new people, they're enjoying learning about what's going on, and we'll be producing a short report about what they've done so far over this year as well, which will come out at the start of next year. I mentioned that we talk about lots of different things. There's summaries of everything that we discuss at the panel on the website. So if you're interested, you can go and check those out. If you have more questions or want more detail about anything we've discussed, there's contact email. So you can email and ask for a more detailed report on any of those meetings as well. These are just some of the things that we've covered over this year. So we spoke to them about the researcher access service. We've spoken to them about the regional safe havens as well, and some of the research projects they've heard about there as well, including brain health pilot, mental health and policing, and household living arrangements during COVID. One of the important things that they do is help us produce communications materials. So there's animations on our website that our panel helped with script writing and gave feedback on the visuals of as well, to make sure that we're communicating as clearly as we can. Some of the upcoming areas of focus, not just for the panel, but more broadly at RDS for public engagement, is synthetic data. We've been tying in with UK-wide public engagement about that as well. The researcher access service, this is an ongoing conversation that we're having as we work towards the next phase. We're also at the moment really interested in private sector access to public data. Again, we'll be tying that in with some broader public engagement as well. I mentioned earlier that we're doing more work to go to where people are. So we piloted some hands-on activities at a recent Doors Open Day in Edinburgh. We had over 100 people engaged. We tested 3 different activities, which included some Lego building that you can see on the screen, a Kaplunk activity, and a sort of discussion-based activity with some post-it notes. We're looking to take these activities more widely and try and talk to lots of different people who might not know about data research otherwise. One of the main ways that we're doing this is through our public engagement fund. We're a team of 2 in the public engagement team at RDS, and through the fund we're able to reach much broader audiences. We actually ran the pilot version of this fund in 2023. There was £56,000 awarded to £8 projects. These projects reached over 2,700 participants across Scotland, and that's a bit of a conservative estimate as well. There were in-depth discussion activities with smaller groups of people. There were activities at festivals, there was activities in schools, there was such a huge range. But as we know, it's not always just about the numbers with public engagement, it's about the impact. And there's a really lovely quote there from one of the projects. This was from a researcher that was involved in the Public Engagement Fund project for the Mental Health Imagining Beyond. And they actually changed the way they ask questions in their research as an outcome of working with this group of people. And that it was the sort of research project they'd hoped would be possible over 10 years ago, but had never seen it until now. And I think that's because part of what we did was trying to keep the fund really broad. We really wanted people to be creative and do what worked for the people that they were working with, rather than being too prescriptive about it. Building on that success, we opened it again this year. We had £30,000 available for projects, and organisations could apply for £1,000 to £10,000 to deliver new work. We had over 30 applications from across Scotland, so it was really popular again. But in the manner of a sort of online influencer, you'll have to come back for part 2 because we aren't going to be announcing them until January. We're just in the process of confirming the successful projects. So hopefully at the next year's DigiFest, we'll be talking about all the great work that's already underway because those projects will be starting in January. The main aims of the projects are to communicate the impact of data research, showcase cutting-edge data research, involve new audiences, and create new partnerships. Some of the really valuable things that happened out of the pilot public engagement fund was those partnerships with community groups, with academic groups, and a lot of those partnerships from 2023 are still going now. The academic institutes are still working with them. And then new for this year, we portioned a bit of the total fund for a pilot community fund. So we wanted to directly fund a community group to work with its audience. So as well as funding, we're also going to give some additional support from the public engagement team at RDS to do that as well and help provide connections as well, so that these community groups can do what they are interested in and what's important to them. So I think that's probably plenty of us speaking for now. We're going to hand over to all of you to ask some questions.
So thanks for coming along today. Thanks to everybody that's joined the session today. Hopefully that's given you some insight into the changes that we're putting in place to ultimately improve cycles of research, to make things faster, simpler, and improve lives with data. So thanks to everybody for joining, and have a good day. And yeah, please stay in touch with what we're doing. All right, take care, everyone. Bye-bye.